Hello everyone, welcome to sqadia.com, and in the third section of our lecture topic subfertility, now we will talk about the investigations. In investigations, we will again talk about what are the investigations done in case of female infertility, what will be the investigations done in case of male infertility, and what is the ovarian measurement of the ovarian reserve. For female patients, the very important test done is called SIS. SIS is saline infusion sonogram. It's an ultrasound procedure to assess the direction of the neck of the womb or uterus here. Sometimes the neck of the uterus is pointed or directed differently, that leads to infertility. So this is SIS is done to find out the neck or the direction of the neck of the uterus. It also confirms the cavity, if the cavity of the uterus is normal, if there is any problem, if the size is defective, if there are any growths, if there is any septum in the uterus. So this is all done to it gives you the idea about all these problems. And then it also confirms the fallopian tubes, if the fallopian tubes are patent or not. That's again very important to find out, because if the tubes or fallopian tubes are blocked, then the fluid won't go from the fallopian tubes and won't be collected into the pouch of the Douglas. So it basically diagnose three very important things. One is the direction of the uterus or the neck of the uterus. It find out if there is any abnormality in the cavity of the uterus, if there is any growth, if there is any septum or polyp. And thirdly, it find out if the fallopian tubes are open or not, or if there is any blockage in the fallopian tube or not. Then the other test done in females is hormone levels are tested. If there is FSH, LH are normal, if estrogen produced by the ovaries is in normal amount, if not, it means there are problems of the hormones. If gonadotrophic hormone again is elevated and estradiol levels are low, so same, if we have high levels of FSH and LH and ovaries are not producing enough estrogen, it means the ovaries are not functioning normally, because once the FSH and LH stimulates the ovaries to produce estrogen, estrogen in turns negatively block the level of FSH and LH. But in this case, if the ovaries are not producing enough estrogen, the level of FSH and LH it keeps on increasing. So that's very, very important test to find out in females if the ovaries are functioning normally or if they are not functioning normally. So these are some very basic tests to find out SIS and then hormone levels to find out if there is any problem in the female system. Then some male investigations are semen analysis is very common, done in every single case of infertility. First test to be done is the semen analysis, in which the semen is analyzed for the sperm count, if sperms are normal in number, in quantity and quality, if they are healthy enough to fertilize the ova. That's important. Sperm count is about 20 million sperm per ml of ejaculation fluid. So this gives semen analysis, help us to find out if the sperm count is normal, if they are healthy or strong enough. About 20 million per ml. So it's a big number of sperms. Again, low count of testosterone, which is a male hormone, FSH, LH, and prolactin. All these are hormones are important for male fertility also. So their level should be tested. Then vasography, this is the picture here of the vasography. Vasography, a dye is injected, and if it flows normally, then it's normal. If not, if it tells, it gives the, if there is any obstruction in the ducts or vessels. So this is the, here on the side you have urinary bladder. So dye is injected and the all these vessels are observed if the dye is flowing normally or if there is any obstruction. Ultrasound is done to find any growths, any masses. That's an important test also. And this acrosome reaction. Acrosome reaction is the test done to find out if the ability of the sperms to go through the ova, to pass through the outer covering of the ova, they have enough strength or not to penetrate the ova. So that's the acrosome reaction test, which is ability of the sperm to fertilize the ova after crossing the outer layer of the ova. Now, the other test commonly done is measurement of the ovarian reserve. Ovarian reserve testing is done to find out if the eggs are healthy and if they have enough quantity and quality of to cause pregnancy or fertilization. FSH level, in this case, you measure the FSH, which is follicle stimulating hormone, on day 2, 3, and 4 of the cycle. And then antral follicle count is done by the ultrasound, transvaginal ultrasound, and you count the number of the follicles produced. These are the immature follicles, follicles with immature ova. And if you count and if they are in enough number, it means there is enough ability to produce the mature ova. So this is antral follicle count. And then anti-Mullerian hormone measurement. This is the hormone produced by the mature follicle. So if they are, it's in enough amount, anti-Mullerian hormone, that gives the idea that the ova or eggs are in good amount or they are in good health to cause fertilization. And the other test to find out the ovarian reserve is clomiphene challenge, which measure FSH level on day 3 and then on day 10. Clomiphene are the tablets used for the stimulation of the ovaries to produce ova. So clomiphene challenge test is also important to find out if there is good reserve of the ovary or not. So ovarian reserve, measurement of the ovarian reserve is mainly performed to find out the ability of the ovaries to produce healthy normal eggs, and if are the ovaries still able to respond to clomiphene stimulation. So we should be we should rely on the ovaries for further testings or for further procedures like intrauterine insemination and IVF or in vitro fertilization. If you see here, there are about at the time of birth, after birth, here before the puberty, each female has about 400,000 ova. Egg number is 400,000. So with time, with each cycle, ova keep on producing and releasing. They keep on decreasing in number. So by about 37 years of age, there are 25,000 ova and by eggs, and about after by the age of menopause there are only 1,000 eggs left. So ovarian reserve testing help us to find out the number of eggs available to, so we can find out how effective will be the further treatment of the infertility, in which IUI and IVF can be done. So that was all about the investigation, female investigations, male investigations, and measurement of the ovarian reserve. Thank you for watching sqadia.com.